Hello, everyone. Hello, everyone. Today, let us start in lecture 4, which focusing in the direct method of health education. Last time we are mentioned the method of health education method. We are mentioned there's two. One of them is the direct method, and second of them is the indirect method. Today we are going to go deeply in the indirect method. As you know, let us before to go deeply, let us to give the short definition about health education. As you know, health education is a process to help the people to learn more about them, to learn more about them health, and also that can help them to take the good decision. Yeah, and also there is two type of the health education method, as I mentioned, direct method, which dealing with the face-to-face communication between you and also with the community. Second method is called it indirect method, which mainly focus on the it is not face to face, just you can use some tools to send a message, yeah, like use poster, radio, and TV. There is someone, his noise us, huh? Please unmute yourself. Who is doing noise for us here? Please mute yourself. Rania. Yeah. Now let us to go to more deeply type of the of direct method of which one of them is the individual approach, yeah. Face to face, face to face teaching. This is when the health worker teach one person at the time. Yeah. Example, one of the example, a nurse explaining how to use the inhaler an asthma patient. Additionally, a midwife can advise the pregnant women on proper nutrition and antenatal care. Moreover, the counselor helps someone to quiet or to quit the smoking. Yeah. This is the example of the individual approach. Yeah. Individual approach is the means, is the face-to-face teaching method. Yeah. And this method is have the advantage. One of the advantage is the tolerate to the person need and understanding. This is the one of them. Another advantage of the individual approach, it is the private and confidentiality. When you are speak with the health workers or with the community, that will be more private and also more confidentiality. The third advantage of the individual approach, face-to-face teaching method, that can immediate feedback and clarification. If you send a message with someone and he couldn't get you well or he couldn't understand you, he immediately can ask you, and also immediately you can give them more clarification and also explanation more. Uh, where we can use the individual approach face-to-face teaching, the best. place to use the individual approach is that dealing with the sensitive issue like sexual health and also mental health. Additionally, teaching the new skills and also following up for the treatment. If the some patient have the treatment with the face-to-face method, you can give them advice on how you can use this treatment. Yeah, this is the one of the method of direct method. One of them, as we mentioned in this slide, is the individual approach, which means face-to-face teaching. Example: nursing explaining how to use the inhaler to the asthma patient. Additionally, midwives advising pregnant women on the proper nutrition and antenatal care. Additionally, counseling helping someone quit or to stop the smoking. The advantage of the individual or direct method to tolerate to the person need and also private and confidentiality, and moreover it is the immediate feedback. If someone he couldn't get you well, you can explain them more. You can explain them more, then that can help them to receive that message. Yeah. This is the one approach of direct method, individual approach. Secondly, call it group approach. Individual approach, as I mentioned, is a person to person. But in the second approach, is you call it group approach. In the group approach, when the health worker teaching a small group of the people, it is not one person. When the health workers they teach like 4 or 7 person as a sample, this is a call it group approach method. The example of the group approach method is a health promoter teaching group mother about vaccination, the cars, their kids or their child. Yeah, this is the one of example. Another example: workshop for the schools children on the hygiene and property. At the sometimes at the school level, they give them the health promotion message: how you can clean their hand and how you can use clean water like that. Yeah, this is among the at the schools like more than 10 or more than 20. This is call it the group approach. Yeah. The third example of the group approach is a session for the farmer on preventing heat stroke. Yeah, sometimes you can give the advice or can give the health promotion message to the farmer to how you can prevent themselves from the heat stroke. Yeah, this is the example. And the secondly, let us see the advantage of the group approach. One of the advantage of the group approach to save the time and reach more people. In one time, you have ability to send a message more than 10 person at the same place and at the same time. Yeah. This is the one advantage of the group approach. Second advantage of the group approach, it is the increased discussion and peer learning. Yeah. When we are sending the message among the community or among the groups, that can help them to do the discussion. During the discussion, that can help them to change the ideas, to change the knowledge, to change the education between them. Yeah. This is the second advantage of the group approach. Yeah. The third advantage of the group approach to build the community support. Yeah, when the people or the community or the group they are sit together and teach together and discussion together, that can help them to give the support each other, because at the groups there is some people they are more educated and well noted or have the good information about the health issue. With this with this group discussion can help them to support each other. This is the second approach for the direct method. One approach we are mentioned face-to-face approach. Secondly, the group approach, and we are mentioned there is some example health promoter teaching the group of the mother about the child vaccination. Additionally, workshop for school children on hygiene and property. The third example session for the farmer on preventing themselves in prevent themselves from the heat stroke. The advantage of the group approach, you can save the time and reach the more people in the same time and same place. Yeah. The second advantage of the group approach can encourage the discussion and peer learning. The third advantage of the group approach is the build community support. Now let us to see the third approach of the direct method of education. And the third approach is the method involving working with the whole community to solve the health problem. Yeah. It is not 20 person, it is working with the whole community to solve some health issue or some health problem. The example, organizing the village. One of the example of the community approach, organizing the village meeting to discuss clean water and sanitation. Sometimes you can sit with all community at the village to discuss about the health issue like clean water and sanitation. This is the one example. The second example of the community approach it is the training the community volunteers to teach other about the cholera. When you are training the community volunteers, the group of the community volunteers to teach other that help them to prevent the cholera. This is the quality. Also, this is some example of the community approach. The third example to holding health day with a free check and education. Yeah. Holding health day with a free check upon an education. Yeah. In one day, you can grouping all people and sit together and also, to do the check, to check or to do the education among the community. Yeah. The activities, key activities of the group approach, it is the community meeting and peer education and village health committee. Yeah, this is the activities. One of the activities, community meeting. You can gather in the community in the same place to identify the health problem and planning for the solution. The second activities for the community approach is the peer education, training local people to teach others. Example, youth leader teaching about the HIV issue. Additionally, village health committee group that help the plan and monitor the activities. This is the third method. This is the third approach of the direct method of health education. Now let us to see the essential skill for the direct health education. There is essential or very important skills for the health promoter to have when you are going to send a message and or when you are going to teach the people you have to have the some skills. One of the skill is a good communication skills. You have as a health promoter, you have to get good communication skills. Speak clearly and slowly. Additionally, use simple words and avoid the medical term. Use local language and also listen carefully to questions. This is a good communication skills. When you are going to send a message about the cholera or about any type of the disease, you have speak clearly and also use simple words. No use jargon, no use medical term. you can use the local language that can help the community or beneficiaries to understand your message. Additionally, can listen carefully to listen them what their ideas and their comment, their suggestion. You have to listen them. Yeah, yeah. This is the one skill is called the good communication skill. The second skills for the direct health communication is the teaching skills. You have to teaching skill break information into small teaching skill how you can break down the complication or big information into the small step to break down to let the audience to understand you. This is teaching skill. Additionally, use the demonstration. You can use sometimes poster or can use like uh, yeah, blackboard that can explain them. Additionally, you have to repeat your message. Sometimes you can repeat more than one time. That can help the audience to understand your word or to understand your education. Yeah, this is the teaching skills. Let's use a picture. With the picture can help your audience to understand well. This is the second skill, which is called the teaching skill. The third skill, which is important for the direct health education, it is the counseling skills. Yeah. Be kind and respectable. You have to respect the people. You have to be kind. Additionally, respect the privacy of the people. Encourage them. Don't blame the other. Don't blame your audience. Help them to make their own decisions. Yeah. This is the counseling skills. To be kind and respectable. Additionally, respect privacy and also encourage. Don't blame them, and moreover, you can help them to make their own decision. Yeah. The fourth skill, which is important for the direct health education, it is called cultural sensitivity. Cultural sensitivity, you have to understand local belief and traditional with when you understand their belief and traditional that can let you to respect them. When you are respect their traditional and their belief, that can let you let them to hear from you or to respect you. This is the culture sensitivity. Moreover, work with the religious and community leaders here. You have to discuss or to see or coordinate with the religious or community leader when you are need to send a message. Additionally, respect gender rules here. Like example, female health worker for the women issue. Yeah, that if there is a issue dealing with the women, you can handle to the female. Yeah, that can managing or handling in the good way. Last skills, monitoring and feedback. Ask the question and check their understanding. When you are sending your message, you have to ask some question to make sure your audience there understand your message. Yeah. Keep record who are talking. Yeah. Also, you have to keep recording. Yeah. This is a skills that is important in the for the health educators. One of them, good communication. Second of them, teaching skills. The third, the counseling skills. The fourth, the cultural sensitivity, and last, monitoring and feedback for the monitoring and feedback from the audience. Yeah, this is the skills which important to follow it. Yeah. Now let us to go to the last slide. In this slide, we are going to make the summarize what you are said in this lecture. Method, as you mentioned, the health education it has the two methods. One of them direct method, and second is the indirect method. Indirect method that means you can send the message directly, face to face. There is no tools used here, just face to face. Yeah. Indirect method, you have to use the tools like TV, radio, Facebook, like that. Yeah. Now let us to focusing in the direct method, which is our lecture or this lecture mainly focusing on the direct method. The direct method have the three method also. One of them individual, second of them the groups, the third is the community. In the individual, that audience will be one person face to face, yeah, will be one person. The characteristics of the individual method is a more personalized and also sensitive issue. If you need to talk with someone or some issue is more privacy or more sensitive, you can use the individual here. Because some people they are shy, some people they are having interest to let their issue to generalize with another people. This is the one of the method is the individual method. Second method is the grouping. Group it is consists like 10 to 20 person. Yeah. This audience will be like 20%. The characteristic teaching skills and sharing the ideas. When you are discussing in the group, the more characteristic will be sharing the ideas. People or the group they are discussing together. Then they are sharing ideas. The third method of the direct method is a community. Community is include all the village. All the village has a different groups of people and also different group of tribe, ideas, ideology. Many people there, some periods. It is characterized by long-term change and big problem. Yeah, if you need to handle the big problem among the community, you have to use the community one because you can sit with all community, different type, ethnic, race, you can sit with them and discuss. Yeah. When you use direct method, that as I mentioned, it is the face to face. Yeah, it is the face to face. It is no mediator. You can talk face to face with your audience. Why you are going to use, yeah, direct method? One of them during the home visit. Sometimes the home visitor or health promoter they are going home to home or house to house to send the message. Yeah. This is the direct method. Additionally, facilities or the health centers. Sometimes you can set with the at the health facilities, the health promoter can sit at the shelter and send the message to the co-patient and also to the patient how you can prevent themselves from the disease. Yeah. The another when I can use the direct method at the school level, you can send the message to the pupils and how you can prevent themselves from the cholera or prevent themselves from the communicable disease. Yeah, this at the school level, you can send the message directly face to face. Moreover, during the emergency, like our disease outbreak right now, like cholera is taking have the outbreak. You can use the direct method because face to face that can help them to prevent themselves from the disease. Yeah. When the starting the new health program, when you are going to handle or when you are going to start new program, you have to do it face to face. Yeah, to let the people know more about it. Yeah. Yeah, these are some practical tips for the health worker. Prepare well when you are going to educate the people or send a message. You have to read the topic and prepare yourself very well. Additionally, use the local example. When you are using the local example, that can to help them to understand your message. Yeah. Moreover, uh, uh, follow up with them when you are teaching them send the message you can follow up and give them the feedback about it as ask them even start with the people no Yeah, as when you are going to start your project or your session, you can ask someone he have some idea about that topics. Yeah. Moreover, encourage the participation. Yeah. Yeah. This is our topic of today. I hope you are get me well. As I mentioned, let's rise of our topic. We are mentioned in health education. We have the two. In health education, we have two methods. One of them it is the direct, and second of them is the indirect. Indirect that means you can discuss with the person face to face. Yeah. And indirect, you are not going to discuss face to face. Just there is some tools like in television and also in radio. In this lecture, mainly we are focusing on the direct method. And we are mentioned in the direct method, we have the three methods. One of them, the individuals. You can send a message like your friend, or if you know that some patient or co-patient, you are going to send a message. One person to one person, one listener and one receiver, one speaker and one receiver. This is the individual. Yeah. Secondly, groups. One person is speaking, like 10 or 12 or 20 person, they are sit and listening about the message. Yeah. This is the grouping. Community, that means you are gathering the whole entire community, like in village or the area, sit them together and discuss about the health issue. Yeah, that can change the idea, thinking more about it and how we can handling that issue. Yeah, this is and all of them, they have the advantage and disadvantage. Moreover, also we are discuss about the some skills that is very important for the health educator. As I mentioned, one of them, you have a good communication, additionally teaching skills and counseling skills. Moreover, culture sensitivity and monitoring feedback. Yeah. This is what we are discussing. I hope you are get me well and understand this lecture. Is there some question or some comment, more clarification, or need more addition? Yeah. If someone have the some comment, floor for you, you are welcome. Yeah. You can unmute yourself and speak.
Oh, okay, nice.
Yeah, go ahead.
Oh,
Go
how
ahead.
are you?